guys, Trista here. Week 8 video for group 6. Well, we had the two articles. The first was the 26-page research article about cystic fibrosis care with patient and professional perspectives and technology. And the other one was an online article with patient experience in evolving providers embracing telehealth. And I thought one thing was interesting about the article was it was based in the UK, and it was talking about patient satisfaction, how both patients and clinicians are moving towards having the electronic access to their healthcare and keeping appointments and keeping up with data and wearables and tracking their healthcare cycles, and how patients still want that face-to-face engagement, but it's also coming with customized healthcare for them and allowing them more freedom, but also added burden to managing it on their own as well. So hopefully things can get more streamlined as they go on.
Something that I actually have never heard of was telehealth, which is basically allowing patients to take advantage of remote consults and other virtual care options in the comfort of their own home. In return, many healthcare organizations are stating it can boost care coordination, manage at-risk patients, and broaden population health efforts. One of the reasons why telehealth is becoming much more apparent, which 90% of organizations are using, is because many are facing staffing challenges and value-based care. 55% offer remote sick visits and 49% offer wellness visits via telehealth. And although many organizations, almost 60%, state that they are more than well enough prepared to offer these online services, the problem is much more than just them, but it's the patient. Many individuals don't have the necessary knowledge or effort to be interacting with doctors online. And although it might feel more convenient to them, how will they know if the patient feels secure and comfortable? Not to mention the fact that not everything is the same when looking at someone in person versus on the screen. How will the doctor evaluate their symptoms, body language, illness, if they cannot physically see or feel the person? Another problem could be many individuals using this as an advantage to get more prescription drugs and continuing drug abuse. Although it might seem like an easy, quick fix, there's much more needed to be evaluated, or else it's just best to stick to the good old-fashioned patient-to-patient interaction.
With today's technology, healthcare can now be more personal and accessible at all times. Technology has allowed for patients to take on an active role with their own health, from mobile apps to mobile devices. In the Healthcare T News article, the author mentions how telehealth, which is a provision of remote healthcare access by means of telecommunications, can help address hospital staff shortages, improve care services, and expand health outcomes. The second article also mentions how technologically enabled self-care and disease management can be done at home. They looked at ways to improve cystic fibrosis care, such as through technological apps similar to the iPhone Health app. And I want to talk about the implications from this article, such as how the data that was collected to support the main argument, which is that we was looking at short-term care for patients with cystic fibrosis, that they would have to further do more research on how they could provide more care for long-term illnesses for high-risk patients. This study can also be used to further investigate other chronic diseases besides cystic fibrosis care to better accommodate various types of patient lifestyles.
The emergence of telehealth does help a lot of the patients. For people who live in the rural area, where it's lack of professional physicians compared to people who live in the large cities, they can get treatment and evaluation of those expertise from the top hospitals. As the best hospitals of all countries around the world usually locate in the big cities, such as Beijing, the capital city of China, and New York, the financial and economical center of the US, we have to acknowledge that medical level of the urban cities are much better than in the rural areas. On the other side, for people who live in the big cities, they are always busy doing their work and thus have less time to see the doctor once they got sick. Telehealth helps them to contact with the physicians in distance so that they can avoid to waste time on traffic. Thus, it is easy to understand that patients' experience can get involved as providers embrace telehealth because it makes much simpler to contact with the doctors.
More healthcare organizations are now embracing telehealth as the new realities of staffing challenges and value-based care becomes apparent. This has increased the interest in home-based health monitoring devices and applications that can be used to facilitate long-term care of chronic conditions like cystic fibrosis. Self-care has its benefits, however, many cystic fibrosis patients found it difficult to manage juggling their life as well as the additional work imposed by the demands of CF self-care. This can be due to the fact that not everyone's day is the same. One day you could go to work or school, but the next day you might have to postpone an appointment that was to review your health and receive the necessary medication because your child got sick. This can cause patients to believe that self-care is a burden in their lives. Self-care can be successful if the trust between patient and doctor is built over time through face-to-face attendance so that one can understand which home-based solution would be the best for the patient.